Hi, my name is Vanessa Graves, and I'm doing my staff development project on newborn jaundice. What is jaundice? It's a yellow color seen in the skin of many newborns, and it happens because the bilirubin builds up in the baby's blood. Jaundice can occur in babies for any race, regardless of their ethnicity or skin color. Low levels of jaundice are okay, but high levels can lead to kernicterus. Early detection and management of jaundice can prevent kernicterus. Babies should be assessed for jaundice every 8 to 12 hours, the first 48 hours of life, and again at 5 days of life. Causes of jaundice. Jaundice develops when red blood cells break down and bilirubin is left. In the womb, the mother's liver removes the bilirubin, but after birth, the newborn's liver is not capable of removing the bilirubin. In some babies, the liver might not be developed enough to efficiently get rid of the bilirubin. So, when too much bilirubin builds up in a baby's body, the skin and the whites of the eyes might look yellow. And the yellow color is called jaundice. Signs of jaundice usually appears on the face and then moves to the chest, belly, and the arms and legs as the bilirubin levels get higher. Jaundice can be hard to see in babies with darker skin. Your baby's doctor can do a blood test to tell how much bilirubin is in the baby's blood. How can jaundice be treated? If the jaundice level is high, the baby will be undressed and put under special lights, which are called bilirubin lights. This can be done in the hospital or at home, and the light will not harm the baby. You just have to keep the eyes protected. The baby's level is extremely high, and exchange transfusion may be done. And putting your baby under the sunlight is not recommended anymore. Risk factors. 60% of babies will have jaundice. Babies born before 37 weeks of pregnancy may have jaundice because their liver is immature. Jaundice may be missed or not recognized in a baby with darker skin color. It's imperative to check the gums and the inner lips to detect jaundice. Some more risk factors are a baby born to East Asia or Mediterranean family is at higher risk of becoming jaundice. A baby who is not eating or wetting or stooling diapers can be in the first few days of life can more likely get jaundice. A baby with a sister or brother that has had jaundice before, you're more predisposed to having that baby develop jaundice also. Risk factors, some more risk factors is bruising. If there's a lot of bruising, the baby will usually form, a bruise will form and the blood leaks out and causing jaundice. And blood incompatibilities, baby's mom has an O blood type and an RH negative factor. Jaundice prevention is the main thing, is to make sure the doctor and the nurse performs a blood test, and to make your follow-up plans to see your doctor after discharge, and treat jaundice seriously. Notify your doctor immediately, or the nurse immediately, if the eyes are very yellow or orange, and the baby's skin is yellow to orange, starting from the head down to the toes. It's hard to wake up or will not sleep, not breastfeeding or drinking well from a bottle, very fussy, and has not had enough wet or dirty diapers. Go to the emergency room immediately if your baby's crying inconsolably or with a high pitch. The baby's back is arched, back with the head or the neck bent backward, and the baby has a strange eye movement. And there's my reference from the CDC. Any questions? You stopped it?